Session over breastfeeding basics. Introduction. Breastfeeding is a skill that is much like riding a bike. It can be difficult when first learning, but soon, with much practice, one will be able to take off riding without their training wheels. It is the purpose of this teaching session to provide you with information to make breastfeeding an enjoyable experience for both parties involved, mommy and baby. Our objectives today. After watching a video demonstrating asymmetrical latching, the client will be able to demonstrate correct latching of infant or the puppet using the asymmetrical latch. After completing the PowerPoint presentation, clients will be able to list the benefits associated with breastfeeding for mother and infant. Following the class on breastfeeding basics, the client will be able to verbalize pumping techniques and guidelines for breastfeeding breast milk storage. Benefits of breastfeeding for mother. It reduces the risk of multiple cancers, breast and ovarian being two of them, postpartum depression. It reduces the risk of low iron anemia. It helps return the uterus to normal size. It develops a special bond between mother and baby. And it saves money. Breast milk is free and always ready. Formula is very expensive. There's a picture that was posted for the Best for Babies. It says economic stimulus packages. Benefits for baby. It protects against allergies, asthma, respiratory infections, and infectious diarrhea. It also decreases the risk of childhood cancers, SIDS, obesity, and diabetes, and ear infections. Exclusive breastfeeding for the first 6 months is recommended by the American Academy of Pediatrics. It contains immunities to diseases and provides baby improves their immune system. It also develops a higher IQ. Here are two more pictures posted by the U.S. Department of Health and Human Services to promote breastfeeding. This one here is about how it decreases allergies for infants, and this one here is how it decreases ear infections in infants. Common misconceptions of breastfeeding. Common myths. Mom isn't getting enough fluids. In this one, mothers think that they need to drink fluids in order to increase their milk supply. This is not the case. Studies have shown that increased consumption of water or increased fluids does not have any impact on their milk production. The guidelines they tell you is to drink to thirst. So if you're thirsty, drink, just don't overdo it. Breastfeeding mothers should avoid certain foods and caffeine. The key to this is everything in moderation. If you eat a well-balanced diet, you can enjoy certain foods and it will not cause any problems, as well as caffeine. If you notice that any foods aggravate the baby's tummy, you can kind of eliminate those out and then introduce them back slowly to see if the baby will tolerate them. It's always going to hurt a little bit. That's not true. It is not supposed to be a painful experience. If it's not a painful experience for you, chances are that it's probably not a very good latch that you got. When to feed. This slide here describes the different infant states, the first being this deep sleep. This is the state that they are completely asleep and you do not want to attempt to feed them. The next state is the light sleep, where they have the rapid eye movement, the REM sleep. This is a good state to begin feedings, especially early on when you're first both learning, because it allows you more time to work with the infant. The quiet alert is whenever they have a still body, they're fixed eyes. It's a good state also to begin feeding. They're getting awake, but not to the point to where they're overly hungry, to where they're going to be upset and aggravated with you. The active alert phase, they're going a little bit restless with the hands and the mouth activities. They have their open eyes and they're rooting. it becomes a little bit more difficult to begin feeding at this point early on, because you do need the extra time to get the proper latch. So if you can try to get in the first or the middle 2 states, those are your best 2 to begin breastfeeding early on. Crying, if you don't want to attempt to feed at this stage, you can attempt to try to reverse the stages. You can put baby skin to skin and kangaroo care. That'll help the baby revert back to a different state, and so that way you can begin to try to nurse. Babies show more cues when they are close to their mother. This is why we promote the rooming in policies. Optimal positioning. Baby is tummy to tummy or chest to breast. The hips are flexed. A saying that we were taught is tummy to mummy, nose to nips, flex the hips to open the lips. The shoulders and the hips should be aligned. The arms and hands should be around the breast. And this is a good picture of a good positioning. You can see the baby's hands up around the mother's breast. Optimal latch. The nose is opposite of the breast to start with. It's going to have a wide open gape. Tilt the head back. The bottom lip and tongue reach the breast first. The nose and chin are close to the breast during the feeding. Angle the mouth opening greater than 140 degrees. The top and bottom lip are sealed and flanged. The round cheek line. They'll have 2 steps to 1 swallow, or 1 step to swallow and burst during the feedings. And they'll have an asymmetrical latch. They'll have a rocker jaw movement. You can see it wiggling behind their ears. And the key is comfort. You want a pain-free for mother. With our little puppet here, we can demonstrate the optimal latch. We have a breast simulation here. You want to start with their nose opposite the breast. They're going to get a wide open mouth. Head's going to tilt back. The bottom lip is going to go. They're going to go on. And they have a big latch. The optimal post-feed. The baby releases the nipple on its own. It has a soft and relaxed body tone. The mother's nipple looks similar to a pre-feeding shape. If it's at all elongated more on one side, if it's reddened on another, getting blisters, anything like that can be cues that you may not have the best latch, to where you can break the baby's suction by putting your finger in the corner of its mouth and trying to relatch the infant. This here is a happy baby after breastfeeding. Now we'll watch a video on the breastfeeding.